Hello guys. This is Dr. Rizwan Mirza. Welcome to my channel at Gurdologist. Aaj hum gurdon ki safai ke bari mein baat karte hain. So let's discuss about a medical procedure called hemodialysis. It is a procedure which is considered if kidney are impaired and not functioning properly. Kidneys are basically responsible for filtering waste products and excess fluids and toxins from the body. When kidneys are not functioning properly, called renal failure, waste products and fluids can build up in the body, leading to complications. To avoid these complications, dialysis is done. Let's discuss the procedure stepwise. First comes the access. To begin hemodialysis, patient needs to have access to their bloodstream. There are 4 main types of access. Double lumen catheter or Joe catheter, which is the temporary access which needs to be removed after some time. Joe cath is commonly inserted in femoral vein, jugular vein and subclavian vein. Then is the perma catheter, which is the permanent catheter, which can be used for some time. Perma cath is commonly inserted in jugular vein and femoral vein. Both Joe catheter and perma catheter gives a transition period for fistula to be made and get matured before starting dialysis from it. Then is arteriovenous fistula, which is made in chronic kidney disease patients who have declining creatinine or are expected to require dialysis in a few months' time. In this procedure, artificial fistula is made between the vein and the artery, for example radiocephalic fistula or brachiocephalic fistula. Then is the arteriovenous graft, in which an artificial tube or graft is inserted between the vein and the artery. It is done in patients in which arteriovenous fistula is not advised. The machine is attached to the patient, next to him either in lying or sitting position. There is a pump in the dialysis machine, which helps draw patient blood from the access point through the tubing and into the dialyzer. Dialysis machine is equipped with a dialyzer which contains special semi-permeable membrane that allows the passage of waste products and excess fluids. So the blood drawn from patient body is filtered through the dialyzer. On the other side of the membrane, a sterile dialysate solution flows counter-current to the blood. This solution contains a carefully balanced composition of electrolytes and minerals to aid in the removal of waste products and maintain proper electrolyte balance in the blood. As the blood and dialysate pass on opposite sides of the membrane, waste products, excess fluids, and electrolytes pass through the membrane into the dialysate. While the cleansed blood continues to circulate through the dialyzer, the used dialysate, now containing waste products and excess fluids from the blood, is then discarded. After the purification process, the clean blood is returned to the patient's body. Dialysis prescription is the settings of dialysis prescribed by the physician to the patient. It varies from patient to patient and is different for each patient. It includes frequency of dialysis, which could be once, twice or thrice per week. Duration of dialysis, which is mostly of 3 to 4 hours per session. Dry weight is the weight of the patient after removal of the excess fluid from the body, at which patient is not symptomatic. BFR is blood flow rate, which is the pump flow rate, at which blood is being pulled from the body. DFR is the dialysate flow rate, rate at which dialysate goes to the dialyzer. Then is the dialyzer type, which could be low flux or high flux dialyzer. Lastly, there would be heparin, which is given as bolus at start of dialysis and then continuously per hour of dialysis. So to summarize, hemodialysis is the medical procedure which is required when kidney function is compromised and the blood is not being cleaned by the kidneys. To remove all the toxins and excess fluid, the procedure of hemodialysis is carried. Subscribe to my channel at YouTube at Gurdologist and press the bell icon for updated video. You can also follow my page at Facebook and follow me on Instagram. And if you like the video, don't forget to like and share the video.